Hi, and welcome to #Podblog. I'm Tom, and this is Hannah. Hannah is our specialist in general podiatry, and today we're going to be discussing nail surgery. The structure of today is going to be that Hannah obviously here is our specialist, and I am going to act as a patient. So I'm basically going to go through a series of questions that I think most people want answered before they come in, hopefully to put your mind at rest and answer those questions that need answering. So I'm going to start with what I think is the most obvious question, which is, well, what is nail surgery?
Okay, so nail surgery is a minor procedure. It involves a local anaesthetic, no stitches, it lasts about an hour. So it's actually quite simple, and I think the word surgery we probably shouldn't use because it's a bit off-putting.
Yeah, absolutely. I think for me, if I was coming in and somebody suggested that I needed something like nail surgery, I'd immediately picture, hospital beds and big operations, and I think it is a little bit misleading.
It's a very simple procedure, which like I said takes no more than an hour.
So what sort of nail conditions would you use something like nail surgery on?
Okay, so we've got an ingrowing toenail, so that could range from just your nail starting to dig in and irritate the skin around your nail. You can also have an angry, infected looking ingrowing toenail. So that's when you may have red toe, swollen, hot. You may even have a little bit of pus. It might look a little bit gunky. Yeah. And also we can also remove thickened or trauma toenails. So if you've got an unsightly looking nail and
sort of thick and
it could be loose. A lot of runners where they've traumaed their nails over years.
They sort of go black and thick.
And they've had enough of them, so we can permanently remove them.
So it's a permanent solution.
Sure
I see a lot of runners who complain that they get these nails that are constantly falling off, and obviously with the repetitive trauma that's occurring through there, this will just rid of those nails for good.
Permanent solution. Yeah.
Fantastic. So what happens during nail surgery?
Okay, so we get you in, you have a local anaesthetic in your toe. It's a bit of a sting, but we will not ever do anything until we know that your toe is completely numb, so don't ever be worried about that. We will have seen you before for an assessment to go through medical history and just to check that you're okay with having a local anaesthetic and any allergies.
I think lots of people have already had things like anaesthetic in places like the dentist, where you kind of get them for fillings and stuff.
That's no different.
Yeah, if you've had it before, you should be absolutely fine to have that again.
And then, as we would have discussed previously, whether you'd like the whole nail removed or just parts, which could just be the sides of the nails removed, that's what we do. We then put a chemical on the base of the nail, which will then stop that piece of nail from ever growing back. That's as simple as it is.
So I've got an ingrowing toenail.
Yeah.
I haven't, but if I had an ingrowing toenail, why would I go for a partial, so take the little bit off, as opposed to like the whole thing?
Okay. So a lot of it is cosmetic. Okay. So you may just want to have your piece of nail, a nail still there basically. Unless you are having severe problems, then I would say remove the whole nail. But usually just a piece removed is more than enough.
I think I've seen a couple of patients who have removed the nail, and they sort of, I guess they paint the skin that's left over.
Yeah,
I don't know
you
if
can do that. You can even get false toenails these days, so that could be an option.
So once it's off, so you put this acid on.
Yes.
And that's it. It never comes back?
Never comes back. There could be a really minor 0.1% that has a tiny bit of regrowth, but it shouldn't be anything that causes irritation.
Okay. Sounds good. So you've come in, you've had the surgery, you've had the injection, and you've had the nail removed, and you've had the acid put on there to stop it coming back. What happens now?
So we put a big bandage on your toe. We then say really go home and rest for the rest of the day, put your feet up. So I'd avoid going back to work, going back to school, and then we see within 48 hours. So we like to check it. Yeah. We bathe the toe in salt water. Okay. redress and show you how to care for it.
Oh, great. So you actually teach me how to look after my toe before
give you all the dressings, written up information. Yeah.
Sounds good. Sounds good. So from a time point of view, I think you sort of touched on it. So I've been in, I've seen somebody, I've seen yourself, and you said, look, this is a nail problem that's going to be something that comes back time and time again. You know, I've decided with you that nail surgery is a good option. First of all, can I drive to the appointment? How do I get to you?
So we say to not drive, just because you have a local anaesthetic in your toe will be numb. A lot of insurance companies, if you were to unfortunately have an accident on the way home, they will void your insurance. So if you can get a lift or a taxi,
drop me in.
Yes, definitely.
So I've got a taxi in. I'm in your office. I think you mentioned it would be about an hour, start to finish?
Yeah, usually, depending on, some people have 2 toenails removed. It depends often on how the anaesthetic goes. Sometimes people can take a bit longer for their toe to go numb, but I would say no more than an hour to an hour and 10 minutes. So.
And do I need to bring anything? So do I need to bring like a pair of sandals or something that's not
you will have some super bandages on, which wouldn't allow a normal pair of shoes to go over them. So a flip-flop, a big slipper, just so that it doesn't put too much pressure on the toe as well. So
something just to help me get back to the car, but without putting pressure on the actual nail.
Okay,
sounds good. All right, so I've come in, I've had my surgery, I've been picked back up outside. Should I book tomorrow off work? What should I be doing?
Usually we say book the following day off work until you have the bandage changed. So you'll have a pretty big bandage on straight after the surgery, and then once we've seen you, it's more like a light dressing. So you would be able to get your normal work shoes on, school shoes, as long as they're roomy and they're not too constrictive, then that should be fine. If you've got a physical job, it might be worth maybe having the surgery on a Thursday, so you've got the weekend to recover.
Makes sense.
Yeah.
Makes sense. Okay. So we've had the surgery. Everything's going well. You've seen me 48 hours later, and it looks good. So at that point, are you giving me education on how to manage this moving forward?
Yeah, so moving forward, it's quite a bit of responsibility from yourself. You need to be bathing your toe in salt water daily and redressing the area. It can sometimes take 6 to 8 weeks to completely heal. Obviously, if you have the whole toenail removed, then it's a bigger surface area to heal. And it also depends on really how your general health is as well. If you've got other conditions, that can sometimes hinder the healing time.
Absolutely. Well, I mean, I'm obviously very healthy, so I'd like to think that it would be.
Weeks,
so talking about things like sports then, so obviously you said maybe 6 to 8 weeks for full heal. Would that be, no sporting activities, certainly things like kicking a ball would be out of the equation?
So I'd probably avoid that for the first 4 weeks possibly. Obviously everybody's different, everybody's bodies react differently to these things, but swimming, definitely I wouldn't advise swimming, just because it's an open area. We're basically causing, we don't want to pick up infection.
That makes sense.
So it's important.
Makes a lot of sense. Are there any reasons that would prevent me from having it?
We'd have to do a pre-assessment, so we'd look if you've got any medical conditions. If you're diabetic, we'd have to get you to check your HbA1c first, just to see what your levels are, and the same if you were on any blood thinning medication. Also, if you're epileptic, that could have a reaction with local anaesthetic, so we'd need to know these things. And obviously if you had any allergies to anaesthetic or similar. So I mean that's something that you would have covered already in your sort of pre-assessment and discussion with the patient. Fantastic. Okay, so right, I've seen you. You've told me, look, this is our options. You can have nail surgery. I'm lucky enough that I've got sort of private medical health insurance. Does that cover me for this? Yes, most health insurances do cover, as far as we know, I think up to around £350 a toe. So definitely worth looking into for sure.
Brilliant. Because I think there are a lot of people out there who probably have got that sort of healthcare and don't realise that that's something that that would be worth looking into. Certainly, that's covered.
For sure, yeah.
Okay, so I think that covers nail surgery really, really well. I think if you would head over to our blog page on www.feetedmotion.co.uk/blog, we will have this video up and running on there, and we will also have some clips of nail surgery actually happening, so some before and after photos of the injections, really anything that we can put in there to sort of ease your mind before you come in for something like this appointment. Yeah. We've also got our Facebook and YouTube channels, which it will be worth keeping up to date with, because we've got a number of videos that we're running, not just things on nail surgery. We've got lots more planned. We've got shockwave, and we've got other conditions of the skin that we'll be discussing with Hannah in more detail. So if you could, find our YouTube channel, which is Ace Feet in Motion. Click the red button, like the film, and subscribe to our channel, and hopefully we'll be able to spread more information about all things lower limb. Good to see you. Take care.